If you're wondering what you should do for your birth plan, we're going to walk you through the MamasteFit birth prep planning template step by step so that you get an idea of what kind of things that you should consider as you are planning for your birth. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and the founder of MamasteFit.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife.
And while we can't necessarily guarantee that our birth will be in one particular way, it's still really important to plan for birth and to understand what options are available to us and our preferences for those options. Something that really contributes towards a positive birth experience is feeling that you were the primary decision maker in your birth experience. And the one way that we can do that is by understanding what options are available to us. It's also important to know that there is no morality to interventions as well. It's not like Pitocin is bad and unmedicated is good. It's all about applying what makes sense for you in your individual birth experience and your individual scenario, because it may differ depending on what is going on during your birth as well. So our birth planning template is a free resource that's available to you. We'll link it down in the notes below so that you can check it out and grab it for yourself. It's a fillable PDF that also comes with our recommended birth packing list, because that's something else that a lot of folks are really, what do I bring to the hospital with me? You don't have to bring everything, but you need to bring some stuff. And so let's walk through our birth planning template step by step so that you know what to consider as you're planning for your birth. So the first thing is going to be just the general information about you, your partner, and any additional support persons that are going to be at your birth. So if you have a doula, maybe family members or friends, whoever is going to be at your birth, it can be really helpful to put on your birth plan so that like your nurse and your provider and like whoever you're interacting with, like know what to call people. Because it's always like really awkward when someone comes in and they just refer to your husband as dad, or like they just kind of point at like your doula and they don't say the names. And so putting people's names on your birth plan can, one, be very helpful so that everyone can be called by their name instead of mama. Hey, mama. Or, hey, you. If you have a name for baby, you can also put it on your birth plan, which is what we have listed here, which can be really helpful so that people know what to call your baby when they're born. If you know what baby's sex is, you can include that. But if it's a surprise, you can include how you want that to be announced. Do you want the provider to say it? Do you want your partner to say it? Do you want to be the one to announce it? So that can also be really important, because if you've waited your whole pregnancy to find out whether you're having a boy or girl, like you might have some strong feelings on how that is announced to the world. Next, you can also put like what clinic you belong to and who your provider is if you have like a specific provider, because sometimes there's multiple clinics that support one hospital. And so knowing like who you belong to can be really helpful for the staff.
And then the last one is your pediatrician. Who is your pediatrician? Because some hospitals will have your pediatrician come in and they can do their assessments there. But most of the time, they're going to call your pediatrician to let them know you had a baby and to schedule your 2-day follow-up. Because usually after you leave the hospital, 24 to 48 hours later, baby has an appointment with your provider or your pediatrician of choice. If you haven't yet chosen a provider for baby, this is also when they'll give you some options and then again, schedule that appointment for you before you go so you don't have to think about it.
So the next thing that is on our birth planning template is, what are your pain relief preferences? And this is just up to you. Do you want to get an epidural? Do you want to go unmedicated? Or are you somewhere in between where you want to try nitrous oxide or IV pain meds? And so kind of ranking your preferences can be really helpful so that the staff knows what your goals are when it comes to birth, or what things they need to hurry up and have available for you.
And if you are open to those pain relief options, what is the order that you would like them to be offered? So you don't want them to go epidural number 1, like offer that first. Maybe you want them to offer nitrous oxide first, or IV pain relief, or some other options before going straight to the epidural. Ranking them can be really helpful for your healthcare staff so that they know which one to offer you first if you look like maybe you need pain relief or if you ask for it.
If you're wanting to go unmedicated, a helpful thing to do is to have a code word or a code word in action. And this lets your partner and your birth team know that you're serious about changing your plan and wanting pain relief. And so this code word allows your birth team to know that you're very serious about changing your plan. And it should be something that's like really random, like pink elephant or like purple cucumber. And you can just put that on your birth plan as well. So that way your nurse or your partner and your doula know like what your code word is, to let them know that you've changed your plan. And you are allowed to change your plan and your mind on any of these options at any time. Just because you wrote them down in a birth plan does not mean that it is like a contract that you will give birth in this way. Things change during labor, and it's okay to change your mind.
The next option is going to be monitoring. So in most hospitals, they're going to offer what's called continuous fetal monitoring. And this is 2 monitors that are placed on the outside of your belly. One is to measure baby's heart rate and one is to measure your contractions. And usually these are either corded into a monitor and they just continuously track baby's heart rate, or there are wireless options or portable options where like it's still transmitting this feed to the monitor system, but you're able to walk around the unit. Continuous is like the gold standard, so it is what is offered in most hospitals, but there is another option. You can choose to be intermittently monitored, and this is an evidence-based option that's supported for low-risk pregnancies. You can ask your providers which one is offered in your hospital, and if they do only offer continuous fetal monitoring, do they have wireless monitors or portable monitors, and are they waterproof? If all of those options are available to you, listing in your birth plan which one you would like to utilize first can be beneficial. So not every hospital will have a wireless portable monitor for every labor room. So if they know up front, like, hey, this lady wants a portable waterproof monitors, let's make sure that she has them because this lady already has an epidural. She does not need the portable waterproof monitors anymore. So we can just take them out of her room, rinse them, clean them, and then give them to her.
Something that can be helpful to know when it comes to monitoring is there are certain interventions that may change how you're being monitored. So if you have Pitocin or you get an epidural, for example, usually you're going to be continuously monitored for those. But if you don't have any interventions or maybe you only have certain types, you may be able to do intermittent monitoring still. So understanding what choices you make during your birth and how that may impact your monitoring can be really helpful as well.
So there may be times during your labors where your providers will recommend an intervention, whether either recommending this intervention based off of your labor progress or potentially things that they're seeing on the monitor with baby. Regardless of why they're recommending the intervention, what would you like to do when they recommend that intervention? Would you like some time to just discuss that with like your support person, your support team, with them out of the room if time permits? Because most of the time there is time to discuss them by yourself. Or would you rather have a shared discussion with your providers of all of the benefits and then being able to decide if you want to go through with this intervention or not? And with everything in life, these interventions have risks and benefits. So deciding, does this intervention have enough benefits for me to choose it? And which interventions am I open to before even going into labor? Like, hey, would I be open to Pitocin at all? Or are there interventions that are like hard passes? No, I will never say yes to this, like vacuums or forceps or Pitocin. Is that like a hard no? But then no, like if there's ones that you absolutely do not want, that does limit the options and tools available to you during your labor.
This can be really helpful to have informed decision-making with your provider because you don't always know every single option that's available to you and what specific scenarios that certain interventions may be the best for. And so knowing that you can have open communication with your provider to discuss what is happening in the moment during your birth and the recommendations can be really helpful to allow you to still be the primary decision maker. The next thing that a lot of folks have a lot of strong opinions about is going to be your pushing preferences. And you may have a strong opinion on what you want to do, and your provider may have a strong opinion on what they would like you to do. And so it's really important to communicate what your preferences are for pushing. So you can first explore what type of positions you would like to push in. So maybe you really want to try side lying, or you really want to try doing a squat position. And you can kind of list out different positions that you want to try. We have some pictures in the birth plan that show a bunch of different pushing positions because sometimes it's hard to explain to somebody and create this visual for them of what you envision for pushing, as opposed to just pointing at our PDF and being like, I would like to try this pushing position. It can be really helpful to, one, talk about your pushing preferences at your prenatal appointment so that you already have an idea of how supported you will probably be in wanting to push in different positions. I would bring it up at triage when you first show up at your birth location to say, hey, these are the positions that I would like to try in, or I would like to explore pushing positions as I go. And then also to your nurse or to your provider when you're getting ready to start pushing, be like, hey, by the way, I would like to try to push in different types of positions, and then be open to exploring different positions as well, because pushing can also just take a long time. When discussing your pushing preferences, you can also annotate whether you want to be coached to push or if you want to just push on your own when you feel that it's right. And then again, being open to kind of changing depending on the scenario as well. If you want like warm compresses or mineral oil or things to help prevent tearing, you can also request that as well in your birth plan as well. And then something else that I find helpful when we're pushing is to have some internal feedback, especially if you have an epidural. But it's also okay to not want any internal feedback as well. So you can include that in your birth plan of whether or not you want them to apply some internal pressure to help you kind of direct your pushes as well. And again, this can be something that you kind of decide in the moment of whether or not it makes sense for you.
So after baby's born, there are different interventions that you can choose to do for that first hour after baby's born. It's like the golden hour. And this is usually some things that they're routinely going to do. They should still ask for consent prior to doing them. But if it's a routine, you may not necessarily need to include in your birth plan, but it can be like different specifics with each intervention that you will want to include. So number one, delayed cord clamping. So with delayed cord clamping, defining the length of delayed cord clamping for you can be helpful, and we have the options listed in our birth plan. So a lot of hospitals will do 30 seconds to a minute routinely, and that's like their norm. But if you're wanting longer than that, identifying that in your birth plan and choosing that can be really helpful. The next option is skin to skin directly after birth. This has been studied and it's very beneficial, but it can be person dependent on what you're wanting with skin to skin. Do you want baby directly to your skin? Or do you want maybe baby placed on a towel? A lot of hospitals will like take your gown off, like unbutton the gown to be able to place baby directly on the skin. If you don't want them to take the gown off and just put baby directly on the gown, that is an option that we have listed in the birth plan that it's a valid choice as well. If you're not able to do skin to skin, who would you like to do skin to skin with instead? Having that listed in your birth plan can kind of avoid any like awkward when somebody hands your baby to somebody that maybe you didn't want them to hold your baby first. The other thing is, who is going to cut the cord? Do you want your provider to cut the cord? Is your partner going to cut the cord? Are you going to cut the cord? That can be helpful to identify it. And then it also can be beneficial for them to know like, hey, we would like to delay the cord clamping a little bit longer and not yet cut the cord. And then the last step is after baby is born, at some point during that first hour, the placenta is born as well. And you can choose, like you can see your placenta, you can take your placenta home, or they can dispose of the placenta. So if you want to at least look at your placenta before they dispose of it, that can be helpful for your staff to know so they can show you all the different pieces of the placenta because you did grow it and it's a pretty cool organ. Or you can just have them dispose of it. You can also encapsulate it. That's not an option we have listed, but that is always an option with your placenta that you can look into further as well.
The next thing on the birth plan is going to be other options that may happen during your birth. So initially, we just kind of talked about labor's going pretty straightforward. What do you want for pain relief? How do you want to be monitored? What do you want to push? And then what do you want done to baby? The next thing that's included in our birth plan is some alternatives to your birth path. And so not everyone is going to go into spontaneous labor, make it to their hospital, push, and then have a baby. Some of us may need to be induced during our labor. In our birth plan, we do list some different options when it comes to induction, and it's important to note that not everybody starts at point A, and not everybody makes it all the way to the very end of all the induction methods. Somewhere along the line is where you will start, and you'll stop whenever you make into active labor. And so you might want to explore what the different induction options are, and we explain in more depth what each of these interventions looks like in our online childbirth education course. So in the birth plan, what we have listed here is, do you want cervical ripening with or without mechanical dilation? Do you want to have mechanical dilation if that's the next step of induction for you? Do you want Pitocin first, or would you like your water broken first? Or is it kind of depending on the scenario for you? And then do you want to explore some other options besides Pitocin? Maybe you want to try nipple stimulation or breast pumping before you make it to Pitocin. And so exploring what these different induction methods are, what your provider's recommendations are, can be really helpful when it comes to planning for an induction. The next part of the birth plan is going to be, what are your C-section birth preferences? And while most of us are probably planning a vaginal birth, it's still important to consider what we may want in the event that we do need a cesarean birth. With the C-section birth preferences, it talks about who do you want to be in the OR with you? Do you want your partner? Do you want additional support persons? Are there any requirements for additional support persons? So in one of the hospitals near us, if you want like your birth doula to come into the OR with you, they normally have to take a class on how to be in the OR before they're like qualified to go in the OR. Other hospitals may not have those same requirements, or they may not allow any additional persons. And so knowing what your hospital's specific policies are can be really helpful. The next thing is, how do you want to view baby being born? Do you want the drape to be dropped? Do you want clear drapes? Do you want like a window? And then again, understanding what options are available, because not every hospital has clear drapes or different options for you to be able to view baby being born. So exploring that with your provider ahead of time can be really helpful. You can also still have preferences for your baby after they're born, such as delayed cord clamping, immediate skin to skin. Where do you want baby to go after they've been born? And discussing those with your provider ahead of time can be really helpful. And then you can also delay a lot of the newborn procedures that are done, such as like any shots or weights or measurements as well, until you're back into your recovery room.
During that first hour after baby is born, this is when they're going to need to know what feeding preference you prefer. So do you prefer to breastfeed or formula feed? Because we like to do that during that first hour. Once you are done feeding baby and an hour at a minimum has passed since baby's been born, this is when they're going to start offering those newborn interventions. And knowing which interventions you would like can be beneficial, such as which medications are you open to? The hepatitis B vaccine, the vitamin K, and then the erythromycin eye ointment are the common ones that are offered. As well as, do you want your bath delayed or immediate, or when would you like the bath? Would you even like baby bathed in the hospital? So having all of these listed out and chosen prior to going to the hospital can be really beneficial in the moment, because some hospitals you might need to sign like a decline form if you don't want the eye ointment or the vitamin K, or some states even require it. So it's like an even bigger process to decline different medications that are considered routine in many hospitals.
So it's important to plan for our birth, not because we're expecting a very specific path for our birth to happen, but rather so that you can explore what your options are, and then you can make informed decisions about what works best for you and for your family. The thing that really contributes towards a positive birth experience is feeling like you were the primary decision maker in your birth experience. And this doesn't mean that you make all of your decisions in a vacuum. You can still consult your medical team, your birth support team, your partner, and even yourself to kind of figure out what feels best for you as you're planning for your birth, and then as you are navigating your birth in real time. So you can check out our free birth planning template down in the notes below to grab this PDF. It's a fillable form that you can print out, and it also includes a birth packing list. If you want to learn more about what the options are available to you in your birth, check out our online childbirth education course, where we break down different birth options, some risk and benefits of them, why you may want a certain option versus another, and ways to explore a conversation with your provider so that you can include them as a part of your informed decision-making process. You can check out our online course at MamasteFit.com/childbirth and use code YouTube10 to get 10% off as a thank you for watching this video. If you enjoy this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release one new workout video every week and 1 to 2 educational videos every week to support your pregnancy, your birth, and beyond.